Hi everyone, today I'll be sharing with you everything that you need to know about cognitive behavioral therapy, otherwise known as CBT. I'll be talking to you about what CBT is, how it works in theory, what are some of the skills that you learn in cognitive behavioral therapy, and what you can expect from a treatment session with a CBT provider. For those of you who don't know, my name is Parky. I'm a postdoctoral fellow in clinical psychology at Stanford University, and I've been studying and practicing cognitive behavioral therapy for the better part of a decade now, so I ostensibly know at least a couple of things about CBT to be able to share with you. So I want to start by talking pretty high level about CBT and some of the main principles of CBT. So the first thing about cognitive behavioral therapy is that it is present focused, meaning it addresses the issues that are coming up in a person's life in the very moment that they're coming into therapy. So it's not like other types of therapies like psychodynamic therapy where you're going into the past, you're studying traumas, and you're not really coming into the present. Usually in CBT, we focus exactly in the present moment, and the only time we go into the past is to understand the present. So the second part of cognitive behavioral therapy then is that it is goal-oriented, meaning there's something that you two are working towards to address the problems in your life. So it's not like other talk therapies where you guys talk about different issues, but never anything gets done outside of the therapy box, but really you two are actually actively working towards to move you towards the life you want to be. So when I think about goal setting, I really see that there are two components where the therapist has a job and the patient has a job. The patient comes up with the higher level goals, and then the therapist collaboratively works to make the goals more concrete and realistic so that you two have a shared vision of where you two want to be. And the reason why this is important is because high level goals like I want to be happier, I want to be less anxious, I want to sleep better, while these are all fantastic goals, they can look very different from person to person. Like you could survey 100 people what it means to be happy, and each person could give you a very different answer. Some people might talk about money, some people might talk about friends and relationships, some people might talk about values or hobbies. So this is going to look different from person to person, and therefore we need to know what that actually looks like for the patient so that we can have a shared vision to be able to move towards. And one strategy I find really helpful to elucidate some of these goals is to ask the magic wand question, where I essentially ask the patient, if I had a magic wand and I waved it and all your problems disappeared, what would look different in your life? And oftentimes from the response, like, well, I'd be spending more time with friends, I'd be re-engaging in old hobbies like playing the guitar, my mood go from 1 to 10 to 5 on 10, all of those things allow us to come up with concrete shared goals that now we can work towards. So another component of cognitive behavioral therapy is that it is time limited, meaning that you're not working with the therapist forever. Usually CBT lasts somewhere between 4 to 15 sessions, depending on at what point all your goals have been met. And really, I see the point of CBT as making you your own therapist, meaning it is skills based, where I give you the clinical tools to be able to put into your back pocket and be able to deal with the issues in your life by yourself without needing me or another therapist or anybody else to be able to resolve your problems. So there are skills that you learn to be able to address the problems in your life. So now I want to share with you how CBT works in theory. So underlying pretty much all the disorders it treats, cognitive behavioral therapy has a framework of understanding how disorders develop and how they are maintained under the CBT model, where essentially there are 4 main components where in different situations, 4 things are elicited: your thoughts, your emotions, your physical sensations, and your behaviors. So in order to illustrate this, I usually like to provide a little bit of a hypothetical scenario where, let's say you're walking down the street and you see a friend across the street and you're waving at them, but they don't respond. They kind of just seem to ignore you. What would be your reaction in that very moment? And some people might be like, well, I would be really anxious because maybe they don't like me. I would feel really, really crappy. I would start to kind of feel the sinking feeling in my chest. And I would probably ignore them or kind of feel really crappy and just withdraw. Whereas other people might be like, well, they might have just had their own medical emergency, or maybe they just didn't notice me, so I probably wouldn't feel super bad about it. Maybe I'll just check in on them a little bit later, so I wouldn't really feel much in my body. So as you can see, the different ways that we can interpret a situation can significantly impact how we think, how we feel it in our body, so both our emotions and physical sensations, and what we do afterwards. So you can imagine how the CBT model is applied into different disorders. Like for example, in the context of depression, let's say somebody gets a really poor mark on their exam, they're gonna have a thought maybe like, I'm a terrible student. They might feel ashamed or guilty or feel really low mood, and then In terms of physical sensation, they might kind of feel this heaviness in their chest, this heaviness in their face, and their behavior might be to withdraw and say, well, I'm a terrible student anyway, so why do I even bother? I'm not going to try, I'm just going to lay in bed all day. So you can imagine how this particular specific pattern when it comes to CBT can maintain this person's low mood over time. So fundamentally, how cognitive behavioral therapy works is that we're trying to break someone out of their trap, like the depression trap or the anxiety trap, and get them back on track. And how CBT proposes that we can do this is that what we can do is that we can focus on restructuring the thoughts as well as the behaviors. If we can change the thought, if we can change the behavior, then we can break out of the cycle that is maintaining a person's disorder and get them into a path of freedom, into a more alternative pattern that is more effective and helpful towards their goals. So let's talk about the actual strategies that you learn in cognitive behavioral therapy to break out of these traps. So broadly speaking, it can be broken down into two sets of strategies, the cognitive strategies and the behavioral strategies. So let's start with some of the cognitive strategies. So the first strategy I'll talk about is evaluating the evidence, where essentially when we think about the thoughts that we have in depression or anxiety, they're usually pretty negatively biased, and there's something we call cognitive distortions or thinking errors where the thoughts are a little bit extreme towards the negative and they're not necessarily fully grounded in reality. Like if we mind read someone and we're thinking, they probably think I'm boring, or if we catastrophize and because we got a C+ on our history paper, we think I'm a terrible student. These kind of thoughts are not necessarily, again, fully fitting the facts of the situation. And what evaluating evidence is essentially saying, wait a minute, I don't know whether this thought is like truly right. Let's actually look at the evidence for and against. So let's take the thought, I'm a terrible student. So in this case, we might say, well, I didn't do so well on my recent paper and also on that like history exam. So there's some evidence supporting the thought. On the other hand, I have been doing really well in biology, and I've been like really engaged with the student council. I've been participating and volunteering, and I recently presented my research. So maybe it's not totally true that I'm a terrible student, and I can come towards a more balanced thought that then reduces some of the negative shame and guilt that I'm experiencing, and maybe make me feel more willing and ready to do things rather than kind of withdraw into my bed. But when it comes to evaluating the evidence, you really don't want to take a fully positive approach, and you don't want to be like, oh, I'm going to go from I'm a terrible student to I'm the best student in the world, because our brain can absolutely smell the BS and it's not going to believe you and you're going to feel worse. So the way I like to think about it is that like you're a lawyer in a court of law, and any evidence you present has to pass the court of law. It can't be subjective stuff. It needs to be objective things that have happened, and it needs to honor both sides of the argument, because usually when we have a negative belief, there's some grain of truth in it, and we want to be able to honor that, to come up with something realistic enough to be able, for our brain to be able to say, hey, this actually makes sense to me, and I actually feel better afterwards. So another cognitive strategy I find really helpful with patients is the best friend technique. And the idea is that oftentimes we are our own worst critics, but we're able to extend a lot of compassion to other people in similar situations. So the best friend technique basically says, hey, if this was your best friend or your mom, your dad, someone you really cared about in the exact same situation as you, what would you say to them? And usually you're able to come up with these amazingly kind and compassionate statements that you can now take and give it to yourself. So for example, let's say it's your friend who is really dealing with all these issues with feeling like they're a poor student. You might be able to come up with a lot of things that you can say to them about all the really great pieces about them and the things that they're doing really well as a student that you might not have been able to extend to yourself. A third strategy sometimes I find really helpful in terms of cognitive therapy is to ask the question, is the thought helpful? Because sometimes thoughts can be true, but they're not particularly helpful. Like if I had a thought that I'm just a loser or I'm not worth anything, sure, like I don't know if this thought is actually true or not, but if the outcome is that I just feel crappier, I feel more withdrawn, I'm less likely to do the things that I enjoy and I value, then the thought itself isn't particularly helpful. And maybe what I can do instead is to say, well, I had a thought like that, but maybe what I can do is just let it go. Maybe I can just allow myself to give some distance to this thought, throw it away, let it kind of pass on by, because ultimately this particular thought just isn't helpful for me, and it doesn't help me towards my goal. So it doesn't matter whether it's true or not, because it wasn't helpful in the first place. So now let's talk a little bit about the behavioral strategies. And some of the behavioral strategies include activity scheduling, where essentially you're basically reintroducing some of the things that have been lost to time or to depression or anxiety back into the person's life. So someone with depression, for example, they might feel really low, they feel like things don't give them the same joy anymore. So they stop doing a lot of things that used to give them positive reinforcement, a sense of mastery, competence, joy, a sense of meaning. So the idea is that we're basically reintroducing those things that they do enjoy to get them out of the depression trap, because the trap basically is I feel depressed, so I stop doing things, so I feel even worse, and then so on and so forth, so that if we gradually reintroduce some of these things that give them a sense of joy, they start to feel a little bit better, giving them a little bit more energy, and then we're getting them on track instead of being on the depression trap. Another common behavioral strategy in CBT are exposures. And what exposures are essentially is that you are sitting with something that you are afraid of. And this is pretty common in treatments of anxiety disorders, like specific phobias of spiders or dogs, or social anxiety disorder, where you're essentially putting yourself in situations and learning how to tolerate the anxiety of the situation, so your brain knows that I can handle it and there's nothing kind of dangerous about the situation itself. So for example, let's say you had a fear of dogs, you might start by looking at pictures of dogs, into videos of dogs, into spending time with small dogs, and then big dogs. So you're creating a bit of a hierarchy where you're saying, I'll start with some of the things that are small but manageable, and then make my way up as I feel more and more confident. And these strategies can be applied to a number of different areas in your life. Like with social anxiety, you can start by talking to your Uber driver and make your way all the way up to asking out the person you really like on a date. In obsessive compulsive disorder, you might touch something that you feel like is kind of dirty and then not wash your hands, all the way up to touching something that is really dirty, or you feel like is really dirty, and then resisting the compulsion or the urge to wash your hands. So that is going to, over time, reduce the distress associated with these feared situations. So a third strategy I find personally really helpful with patients is something called the behavioral experiment, where essentially our brain is constantly making predictions in everyday life, and usually those predictions are pretty negative. Like, if I try out that restaurant, I'm not going to like it. If I ask that person out, they're going to say no. If I apply for that job, I'm not going to get it. And the behavioral experiment basically says, well, actually, I don't really know, so why don't I give it a try just to see what happens? What would happen if I were to try out a new restaurant or a movie that I didn't think I would like? Would I actually maybe like it? So maybe sometimes uncertainty is actually a positive thing, or even if it is a negative thing, I'll learn that I'm going to be able to survive and it's going to be okay. So the secret with a behavioral experiment is that it's actually a win-win. Either you learn that uncertainty doesn't mean negative, or you learn that you can cope with it when it is. So the final strategy I'll talk about are relaxation exercises. And relaxation exercises are really meant as a way to reduce physiological arousal, reduce the fight or flight response, so that you're bringing yourself into a more of a less stressed state. And this can be done in a number of different ways. You can do it through diaphragmatic breathing, where you're kind of breathing in into your belly and then exhaling through the mouth. It can be done by guided imagery, where you bring yourself into a nice place, of like, a beach or nature, some kind of scenery that really feels comfortable and safe for you, to be able to, again, reduce the physiological arousal, reduce the anxiety, and generally put yourself in more of a nourished state. So when it comes to cognitive behavioral therapy, one of the concepts that I find really important as a therapist is something called the case formulation approach. And the case formulation approach basically asks the $50 question, what is it that maintains this person's problem? And the reason why I think this is important is because when we use CBT, there's so many different skills that we can technically use to be able to support a patient, that we don't want to just throw the kitchen sink at the wall and see what sticks. We really want to be nuanced and precise as to what strategy is going to be most helpful for that particular patient. So for example, in cases where a patient is dealing with a specific phobia, like a fear of spiders or dogs, then it'd be really helpful for this patient to have an exposure hierarchy and be able to sit with some of their fears. Or if someone has like an allergy to uncertainty and they're really worried about all these what if questions, then maybe a behavioral experiment is going to be particularly helpful to show that uncertainty isn't always a bad thing. Or in the context of depression, where a patient has stopped doing so many of the things that they enjoy, maybe activity scheduling with some cognitive therapy to target those unhelpful thoughts are going to be helpful. So we don't want to take a very cookie cutter manualized approach to CBT, because that's not going to be helpful. It's only helpful if we're using the specific quiver, the specific arrow that we are using as a clinical tool to be able to precisely address the person's problem. So following that, I do want to talk briefly about the pitfalls of cognitive behavioral therapy, because not all therapists are well trained in CBT to deliver it in a nuanced and flexible way that actually benefits the patients. Because sometimes some of the pitfalls include that it's very manualized, meaning that people are just kind of saying, session 1 I'm going to do relaxation, session 2 I'm going to do cognitive therapy, session 3 I'm going to do X, Y, Z. And the problem with this approach is that some patients are not going to benefit until like session 7, because they haven't learned any of the specific skills actually conducive to treating their problem. So when we're working working with CBT, we really want to take a flexible and nuanced case formulation approach. Otherwise, you're going to be learning skills that are not going to be helpful, and then you're going to think this is a waste of time because none of these strategies are helping me, and I feel hopeless about the situation. So in this case, the focus on a manualized cookie cutter treatment actually dissuades and makes a person feel like CBT is not effective. Another possible pitfall of CBT is that there's a really significant focus on change. And the problem with focusing too much on change is that it can be really invalidating for some people, like people who've dealt with past traumas or deal with chronic pain. It can feel really sucky to hear from somebody just say, oh, go take a walk, or just do some more exercise, or you shouldn't think like that because it doesn't help you. When you just focus specifically on change and making the person do something different, this can be very, very invalidating for the patient. So it's important to be able to honor and balance validation and acceptance of some of the things that are going on that makes it hard for the patient with the pieces of change, with the use of the strategies, so that you're really supporting the patient in a very patient-focused manner that isn't going to be validating their experience. Finally, some people just don't vibe with the teachings of CBT. They understand it, they know it's skills-based, it's kind of cool in its own way, but that's not really what they're looking for in treatment. Like, some people really do want to deep dive and explore their past experiences and all their traumas and how that's impacted their present moment. Some people vibe with other types of therapies, like the idea of like radical acceptance and dialectical behavior therapy, or the focus on values and psychological flexibility and acceptance commitment-based therapy. So in that context, it's okay for you to not enjoy or really like the ideas and principles underlying cognitive behavioral therapy, and it's totally okay for you to choose a different therapy because many of them are evidence-based and many of them can really fit you in terms of your needs. Now I'd like to share with you what it actually looks like to be in a treatment session, or what you can expect as part of a CBT provider when it comes to therapy. Usually, for me at least, in the first session, I first like to ask the question, what brought you into therapy? What are some of your struggles? Just to get a detailed sense of what's been going on with the patient, start to conceptualize and understand what could be some things that we do as part of the therapy. Then we move into a bit of goal setting. I might ask the magic wand question, what it would look like if treatment was successful for you. How can we have a shared vision to move you towards your goals? And then after that, I share a little bit about the CBT model, just like I did today, talk about some of the skills we might use, and then get them thinking about whether this feels like a treatment provider and treatment program that feels like a good fit for them. And then if they think so, we might provide a little bit of home practice in between, do a couple of skills just to see if there's any movement. And then in subsequent sessions, we really get into the thick of it, really figure out what are the problems that are going on, and providing tailored services of this is the skill you could try, this exposure is something we could try. Let's come up with some strategies together to be able to get you towards your goal. So the research evidence for cognitive behavioral therapy is very strong. Most patients improve somewhere between 8 to 15 sessions. Some people might need a little bit more, some people might need a little bit less, but usually 8 to 15 weekly sessions is sufficient for someone to really feel like they've gotten a good grasp on all the skills and then be able to take it with them. But certainly if you're somebody who feels like they need a little bit more support, or it moves into a bit more supportive counseling or other different types of therapy, that is totally okay. This is just kind of based off the general research when it comes to this idea of becoming your own therapist, taking the skills and being able to take it with you even without your therapist. So if you are interested in cognitive behavioral therapy, I definitely encourage you to find a provider who really specializes in CBT, who have a really nice nuanced understanding of the treatments, and when they're talking with you and maybe in that initial consultation call, it really does seem like they have a good understanding of your presenting problem and the specific CBT strategies needed to be able to address them in a nuanced way rather than done in sort of a cookie cutter manualized approach. So hopefully this video was helpful in understanding a little bit more about cognitive behavioral therapy, what it is, how it works in theory, what are some of the skills you can use, and also what you can expect as part of a treatment session. If you found this video helpful, I encourage you to subscribe because I'll be continuing to make more videos like this in the future. Thanks for watching, take care.